When I was in hospital, a nurse told me that our nervous systems are like cities. They have highways with cars that deliver important messages all around my body. But sometimes the signalling gets lost, the drives get confused and they begin to attack each other, causing roadblocks, and this is what happened to me. Transverse myelitis is a rare neurological autoimmune disease. Max was 7 when he was playing with his sisters 1 minute and on the floor paralysed the next. He was diagnosed with acute idiopathic transverse myelitis. Acute meaning his onset was short and fast. Idiopathic meaning arising spontaneously with no known underlying causes. Transverse relating to the involvement of the entire width of the spine. And myelitis, which is another word for spinal inflammation. During an autoimmune reaction, the immune system mistakenly recognises healthy cells in the body as pathogens and attacks, causing inflammation in the spinal cord and stripping the protective myelin sheath from the axon, resulting in decreased or halted electrical conductivity within the nervous system or roadblocks. Onset of transverse myelitis can happen within seconds or can progress over hours, days, weeks, or even months. Implications can range from mild weakness to complete paralysis and quadriplegia. Causes can be idiopathic or can have underlying factors such as multiple sclerosis or neuromyelitis optica. The level and extent of the damage within the spine determines the level and extent of the paralysis. Max's inflammation was complete and experienced within his C1, C2, C3 and his brainstem, so he lost all function from his neck down, including his breathing. Corticosteroids and intravenous immunoglobulins are essential interventions within the initial onset of symptom stage to slow down or halt the inflammation process and potentially reduce the damage and implications. If they both fail to have the desired results, an immunomodulatory therapy called plasma exchange can be initiated to clean the blood and involves the removal, treatment and return or exchange of blood plasma components from a donor or with a plasma substitute. Corticosteroids such as methylprednisolone can be administered orally, intramuscularly or intravenously and aim to reduce inflammation and immune system activity. Corticosteroids have a rapid absorption and binding rate with biological effects seen after 2 to 8 hours. Terminal half-life is 1 to 3 hours and elimination pathway is through hepatic metabolism and renal excretion. Once administered, corticosteroids enter the cell and bind with cell receptors within the cytoplasm. It can then enter the nucleus where it begins to influence proteins that regulate inflammation and stimulate the protein that is essential in formation of inflammatory mediators. Contraindications depend upon the indication, but can include peptic ulcers, osteoporosis and current infection. Adverse effects can include increased appetite, weight gain, suppressed immune systems, and extreme mood swings or roid rage. There is a highly specialised and lengthy process to manufacture IVIG. Tens of thousands of healthy blood donors donate their plasma and it is then pulled together. It is chemically treated, immunoglobulins isolated and other proteins and pathogens removed. The end result is a highly purified immunoglobulin preparation ready to be infused. In autoimmune disease, IVIG helps regulate an overactive immune system by signalling to slow down or stop an inflammatory process. It can also serve as a target for the autoantibodies, redirecting them away from the healthy tissue. Residual pain can occur and remain for life. Chronic pain management aims to relax the muscles and can include analgesics and non-steroidal anti-inflammatories that prevent the damaged and injured cells from producing pain-causing chemicals such as prostaglandin. Neuropathic pain can be managed with antidepressants and anticonvulsants that dampen pain signals sent to the brain. The FDA has recently awarded an orphan drug designation to GeNeuro, a clinical stage pharmaceutical company who are researching new approaches to autoimmune disease. The biotech's new drug, GNB-AC1, is in discussions for an upcoming phase 2 study and will target chronic demyelination, remyelination, and may even achieve the impossible task of repairing damaged neurons, meaning paraplegics facing life with little to no movement may potentially have their roads repaired and one day walk again. We were fortunate enough to have the backup of an amazing medical team, experienced within their field and not being afraid to test and treat. They showed passion for my son, an aggression towards the disease, and ensured a quick diagnosis within a very rare and complex field. Max was diagnosed and consequently treated within 24 hours of his onset of symptoms. He was administered IV and oral steroids and IV immunoglobulins to reduce his inflammation and slow down his overactive immune system. Despite what the professionals told us, despite what was written in the medical textbooks, Max told us all that he was going to walk again, and after a month in hospital, he shed his wheelchair and walked himself out of rehab. We were the lucky ones. Max will now have a rare disease for life and residual damage and disability, but early diagnosis, medical intervention and treatment to halt the inflammation, not to mention his bulletproof attitude, ensured our Maxie beat the odds and beat transverse myelitis.